So we've got a few folks here who could just give you a quick overview of their interest in transformational change. And when you've heard George, though, we know what you're going to say.
Oh, okay.
We've heard your bit. So have you got more to say?
Well, I was going to say a little bit about collaboration.
All right, bit on collaboration, cool. So a couple of minutes on each, and then could we have a bit more, let's not do Q&As, because it's a bit, let's do a bit more of a conversation. You start something, we'll start something, you start something. A bit more like that?
Yeah.
Go on then, Julie, off you go. You can start us with your, why you're here, love.
Okay, right, I'm here because I run a think tank called 2020 Health, and we are very interested in how we do things better, how we improve health across the nation and actually beyond our borders as well. And as an organisation, we've been particularly interested in how we use technology to improve what we do and how we do it in healthcare. We think the healthcare system is about 20 years at least behind every other sector of our lives and the way that we operate in, whether it's shopping or banking, whatever it happens to be. So there's a lot of catch up to do. So we've done some work looking at IT, at the opportunities for telehealth and remote monitoring, a lot of which we've heard sort of case studies of today. And also we are interested in personal healthcare records and who does this really well. And the organisation that does this really well is the Veterans Health Administration in the States. We brought out a short report last year. We're bringing out a much more in-depth report at the expo that Beverly referred to when she was speaking. So that's in a couple of weeks' time, and that will be available on our website. And we've gone into real detail about how the VHA actually turned around what was a basket case organisation into one of the best, most efficient, most technically astute organisations that there is today, possibly the best organised healthcare organisation in the world. And so that document will tell you a lot more about that and what the opportunities there are for you to learn from that. Technology is, I would say, one answer to the question of NHS productivity. Two other answers, I would say, are self-care and the workforce. And with self-care, that's very much about changing the culture, and we've talked a lot about changing the culture today, but changing the culture and the mindset of how we deal with people that we're working with, and particularly with patients. And there needs to be, I think, a change in regard for people that we work with, and a sense of the parity of esteem between us as patients or us as professionals and those that we're working with, because we can't, as professionals, and I was an NHS professional, we can't go on in a very paternalistic way, expecting to dole out care, advice, whatever it happens to be, without encouraging individuals to take a lot more responsibility for themselves. And that is going to be quite personal. Different people will be able to do different things, but there is a real appetite and a real opportunity to do that and to reduce the dependent situation that we've got at the moment. So secondly, self-care. Thirdly, workforce. I don't actually think we've got the workforce we need anymore. And if you look at some of the emerging areas around the world where they're looking at how they can meet their healthcare needs, they're not thinking about how many doctors and how many nurses. They're thinking, right, this is a skill set we need, and this is what we're going to train people to be able to do, to be able to deliver a little bit of healthcare, a bit of social care, a bit of DIY ability as well, so that when they go into someone's home, visit a particular area, they've got those different skills that person needs them to be bringing to them, so that they're not dependent on three different people coming to meet those needs. And I just think we've got to get out of our boxes in this country and start thinking about what people actually need, particularly older people, so that we can get beyond this web that we saw earlier of all the different people that are interfacing with one particular person. Think about the workforce in a much more creative, imaginative way, so that it's fit for the 21st century.
Thank you. Okay, we'll go through all of them, and then you can pick what you fancy talking about. George.
Okay,
you might need to sit closer, George.
The piece that I'd like to contribute to this panel is looking at the change and the way that change gets managed, is trying to combat the fear of change. And as we get distributed about businesses and we perhaps become more isolated and the change gets really quite frightening, it's actually bringing people back together. And once again, adopting the social metaphor, how do we collaborate at work? How do we provide collaboration systems that enable people who are perhaps working in different agencies to collaborate within one particular initiative and so on? So what you'll see within WorkDocs is that we have those collaboration centres where you can bring people together, put multiple agencies together, put different types of people together, and you can do that from a ward and bring a locum into a ward so he's pre-briefed on the people that he's going to be working with, to a multi-agency initiative where you've got social services, you've got the blue light, and so on and so forth. And that can all talk together, communicate, share information securely. And that's really an important part of defraying the fear, because you're talking to people.
Cool. All right. Got it. Next one. Ready? Clint, you're going to talk about integration?
I can, absolutely.
Thanks,
Becky. Okay. What I thought I'd do is just very briefly share some experiences from a Canadian that's gone across the Commonwealth a little bit and has resided here in the UK since 2008. I think really we are at a critical time within the NHS. We've got a huge opportunity to affect real change. If you think of some of the things that we've seen, again, just to recap really quickly, vast structural change within commissioning groups, the role of technology being devolved to local levels to really instill best practice, and then integration. See, I told you, I'd talk about it. Person-centered coordinated care, and really looking at how that is perhaps the linchpin to keeping sustainability within our healthcare system. So there's three things in terms of bolstering our position right now and how we affect change and transformational change at that. I think firstly, we need to broaden our views of the delivery of outcomes across the care continuum. I think Mike alluded to that earlier today in terms of kind of the singular tribal agendas. We need to wipe that away. We need to look at removing silos, stovetops, stovepipes, or even top hats. And we need to do that in such a way that it looks at new incentivization across stakeholders, across the care continuum, to make sure that people are working as a team to deliver the outcomes patient-centric. I think that's the first piece. I think the second piece is strategic leadership, and we need to have the leaders at the top instill in us all the art of the possible. So what is it out there that we can do to deliver this? Because it is a monumental task per se. Certainly looks that way, and certainly when you look at the economic data that was shown earlier today, it's huge. So we need to have that from the top down, but realizing that local best practice from a clinical point is going to drive that change and is going to make that change effectively throughout. So we need that bottom-up approach to engage individuals across health and social care and third sector and volunteer services, and really tie those people all together. I think small steps towards that big initiative, and we can make successes and celebrate those successes along the way. The third and last thing, I think, is a framework. I think we've heard that today as well. A framework to enable and act as a mechanism to facilitate the coordination of care. And I would suggest that technology is going to play a part within that mechanism. And I think that it's important to look at not static data, but more coordinated dynamic intervention. I think we need to look at not point-in-time data, but we need to look at actions and logistics to move people around the continuum of care. And I think we should almost look at decisively thinking less about discharge and more about transitions of care across agencies. And I think that's a big idea. I think it's almost an analogy of an air traffic control system, capturing where patients take off, where they land within the system, and all of the different things that can happen along that journey, and each journey thereafter as well, and ensuring that we navigate through that to the best outcomes possible. There you have it.
Okay, thank you. Now I think this is an area of territory that I know absolutely nothing. Andy, but you're going to talk a bit more on the estates end of stuff.
Yes, thanks. Essentially, I'm here today to not only get behind the idea of changing within the NHS, but also looking how we can utilise the estate of the NHS to create essentially an energy-saving fund from which we can use to fund transformational change, particularly using technology. There's a lot of technologies, as George said earlier, about like work docs and things like that, where essentially a payback product can be used to create a sustainable fund in which to put back into patient care. This has kind of been picked up throughout the UK at the moment, with the Department of Health recently releasing a new energy efficiency fund, where the stipulation is that you can only apply for this fund if you can demonstrate that the savings are going back into patient care, and exactly how that's going to happen. So I think to be able to make these changes within the NHS, we need to have a clear view on how we're going to fund that, and I think technology will be a good way forward to do that from the healthcare estate itself.
So I guess all going through your heads is all the reasons why at one level it seems crazy that we've got all these ideas and we don't all do it. And the second level is we know how difficult we find it to change ourselves. Some of us are way into our late 40s, early 50s. Change is something that other people do. Because I know best, I've been doing this so long now. So so one of the things that I know is that people own what they create. And one of the most innovative organisations I've worked with is the Care Plus group in Grimsby, learning disabilities, physical disabilities. Not the easiest client group to both communicate with and to develop solutions for. And I was talking to two stories, and these are way out of your technology world, folks. These are two stories. One was a guy who was running the Meals on Wheels service. So he was a driver. And originally he was just taking people to and fro outpatients, and then he's bored. So he says to the chief exec, Lance, who I know reasonably well, said, could I do something else as well? You know? He said, well, could you do the Meals on Wheels? So, well, I'll do that. So then he says to him, well, why am I taking people Meals on Wheels? They're all lonely. They're sitting there on their own eating this crap food. He said, I tell you what, I'm going to take them shopping. So now he picks up the Meals on Wheels people and takes them shopping. They said, well, could we not cook together? Here we go. This is a fantastic transformation. So this is somebody who was originally a bus driver, taking in a whole, and of course all Lance did was go, that's a good idea, what can we do to unblock that for you? Not, oh my God, you're a pain in the neck, can you not just do the driving? They're completely different attitudes. So here's the CEO listening to somebody that's just trying to solve problems and do everything he can to help them solve that problem. Another story, a gentleman with learning disabilities, and he kept banging on the door at George, who was a manager. He kept banging on the door, saying, give us a job, George, give us a job. And George was going, you don't really want a job, do you? What do you want a job for? Go, give us a job, give us a job. And he's trying to think what on earth job he could give this chap, but he wanted paying, so it wasn't any old job. He wanted a job he'd pay for. Anyway, the client, really nice chap, was just going for it. And in the end, George said, do you know what? He said, I know what you could do. Could you just help June clear up at the end of the lunch we're doing? And it was, I can't remember, it would have been some lunch for older people. So he said, yeah, I could do that. And he could literally manage an hour a week. That was as much of a job as he could actually cope with. He wears a suit every day and he gets paid for his hour a week. And he is like, Becky, I'm going to be a counsellor next. And I think, what that does. So there are some things that are absolutely at the technology end, yep. And there are some things about how do we listen to people's real solutions to their real problems on a daily basis, and how that absolutely transforms people's ability to be innovative. So let's have a conversation about how do we release the innovation in all our staff and in ourselves, even some of us who are on the more elderly end of the spectrum. How do we release that innovation? How do we find the motivation to do some really great stuff together? What does that look like?
A couple of the stories that have just come through are about leadership, aren't they? And I liked your first story because I've always thought that Gandhi was a great leader, because he used to say, there go my people, I must go after them, for I am their leader. And it's about enabling the people who follow you to do something different, is what real leadership is all about. So I really like that story, because that's enabling somebody to do something bigger than they ever had vision for before. And I think that's so important in the NHS, because you just cannot possibly conceptualize that people don't have those ideas. How do you release them when you've channeled them into a role where they only get paid if they tick that box?
So come on, have you got any stories? Stories? Give us a story. Something great you've done.
How do you release sort of the innovation in everybody? I think, you see, I've sat in this conference and I've been inspired by various talks, particularly the Texas story down there, which sort of goes with the sunshine of today, so thank you. I don't know if the sunshine is still outside, but the problem though, and you know, this is maybe a room of the converted, is when you get back to work and you're maybe not in one of these great organisations that are getting it right, this sort of stuff just doesn't connect. And even what the trust might be saying its vision is, doesn't connect with what's going on in the trust or the university. I also work in the university sector. So that's my puzzlement, going back to your original thing. And, you know, how do we achieve that? How do the messages that are given in meetings like this, and I've been to a few, which seem actually quite alien to quite a lot of the NHS, because they don't match up. You know, there are good examples, and that's fine, you know, but to allow people to be innovative, you have to give them a sense of ownership at work and a sense of belonging and a lack of alienation from the NHS that they're part of. You know, I qualified in 1989, so I'm also elderly. And when I first went for my first junior doctor job, I was so proud of working for the NHS, really very proud. You know, it was a big achievement for me. And as I've gone through the NHS, and it has abused me in various ways as a junior doctor with hours, etc., and so on and so forth, I won't bore you with all the stories, over time, your goodwill dissipates. I've still got some goodwill, which is why I'm at this meeting. But I think that's the problem, is how do you let people feel they can contribute? Because the structures within the NHS, the management structures, actually are very rigid. They give off in the vision statements and in the glossy brochures an open style of management. Yet, in practice, they're very classical and tight, and they don't allow people enough freedom. And even when people are delegated certain tasks, they're so micromanaged that they can't be allowed to get on. And over time, people will disengage. And that's my puzzlement. So if you've got a solution for that I can take back.
We'll come back to, so one of the other things I know about innovation is born out of frustration. So it's great to be frustrated because people will shift a bit. So anybody else in the audience got a solution to that before we take the panels? Just say who you are, it'd be lovely.
I'm Nancy Bartlett. I'm from Dallas, Texas. And thank you. Micromanagement kills creativity. Yeah. It just does. So if that's a big stumbling block, that has to be the first thing to be addressed. I heard a story years ago, which I put into practice, and I want to share that with you. Arthur Andersen, which is a big accounting and audit firm, or was before they teamed up with Enron and went down in flames. They were doing an audit of NASA. And of course, on those audits, you go out and you interview a lot of staff. And they interviewed one of the janitors. And they said, well, what is it that you do here? Exactly. And in great detail, he explained exactly how what he did helped put man on the moon. And it was a very inspiring story because he was quite sincere and quite energized and quite excited about his work because he could see a very clear link between what he did every day and the outcome of what that organization was all about. So I went back to my teams. I oversaw about 8 different departments in the city at the time. And I decided that each time I went to one of those staff meetings, a couple of days ahead of time, I would contact 2 or 3 staff members and I said, I want you at our next staff meeting to stand up and tell people how what you do helps us achieve that strategic goal. And the city had 10 strategic goals, so every department was attached to at least one of them. And the first time I did that, people were a little nervous. And I said, just take 2 or 3 minutes. That's all you need. Just from your point of view, how does that work? And when they did it, they would stand up with huge smiles on their faces, quite literally, and take on these power poses and get all excited about what they did. And other people would applaud because they could think and say exactly how what they did every day made a huge difference for the citizens of their community. And they told me afterwards that that was the most empowering thing they'd ever done, that they'd never thought about their jobs exactly that way. They'd been thinking of it as a job. I go to work, I do these things, and that's great. But they didn't have that connection. So I think that's a long way of answering your question, but I think when people can see that connection, here's what I do. It matters, and it's important. You are well on your way to getting employees engaged. And so before you jump into lean or anything else like that, and I certainly gave examples of how the city had done a number of things, but first, to get people engaged, let them know they have value and be sincere about it. It can't be the big mission statement on the wall that nobody reads and nobody cares about. If you want a great mission statement, you take a vertical slice of your organization and you let them create it, which is one of the things that we did. But you've got to get that personal engagement before anything else can happen.
So let's see what the panel can do about the very specific question, which is, there's just me. I go back into my organisation and there's a monolith of oppression. Let's see. Can you answer any of that, anybody?
I would start straight away with either a collaboration group, stick it on LinkedIn, put it on Facebook, start talking to people, and then invite the people who are your blockers to be part of that community, because they've got to see the conversations that you're having, because sometimes they just, there's just a mismatch between expectations here. And I would say use WorkDocs, because you can use all those multicultural and multi-agency type of connections that we can provide, and you can keep it private, which is quite useful within an organisation like the NHS. But if not, just put it on LinkedIn, start a group, start talking to each other.
So first job, find some friends. Okay? Sorry, darling, sorry. You could use LinkedIn. Find some friends, maybe in your space.
That's fine too, bring them in.
Next, who's next?
Yeah, I'll go next.
Find
Basically,
friends.
what I'd say in the, obviously supplying to the NHS, one of the things that we find very useful are case studies. So if someone somewhere, we were talking earlier, Beverly was saying about pockets of innovation. Once you identify a pocket of innovation, get it written up, get it into some kind of format that's either standardised across the NHS or something that you think your colleagues might be interested in. Get those together and then use any way that you can to get it out there, whether it's dropping it on their desk, whether it's LinkedIn, whether it's Facebook, when it's anything really. It's kind of saying, look, someone else is doing this, it looks good, they're getting this, how can we help?
So second one is perturb the system. One thing I know about perturbing the system is you have to do it more than once. Okay, so don't do one case study, then, oh, sorry, they didn't listen to me, I'm not going to do it again. So find some friends, perturb the system.
Okay, so paint a big picture, okay? I've got 3 daughters, I like pictures, say 1,000 words, all that kind of stuff. So paint the picture, and the picture is, how do we circumvent fear, uncertainty, and doubt? Really, right? It's a lot easier to say, oh, no, we'll never do that, we can't do that, oh my gosh, that's a big hurdle. It's easier to just walk away and kind of ignore it. So paint the big picture and say, look, the status quo is no longer an option. We really do have to change. We have to step up. And you know what? Human ingenuity, sadly, we work well under pressure sometimes. And so it's amazing what we'll come up with in terms of those type of solutions. Quick story. Anybody remember the ash cloud, right? Were you traveling at all? I was traveling in Istanbul. And there was, this is coordination of services around a client, me, sitting in Istanbul. I was lucky. So, I was coordinated, rerouted, and I got back to England without, too much more than a couple of 3 or 4 days paid holiday. Other people weren't so lucky. The human ingenuity there, I saw people looking to take boats across over to Italy and then to rent a car and drive back home once they were on the mainland. But they couldn't get on the ferries because you had to have a vehicle. So they would go out and buy, true story, I'm gonna go buy a bicycle, I'm gonna then have my vehicle, get on the ferry, sail across, dump the bike, rent a car, and get home, because they were just that sick of it. So if we can kind of paint that big picture to say, you know what, remove those barriers and let's get real, folks. We have to make this change, and we have to do it together.
Okay. Some sad gits not wanting a holiday. So we've got find a friend, perturb the system, paint a big picture that's compelling. Got one, Julie?
Well, the thought that came to my mind when you were talking was Julie Bailey, and cure the NHS. And I don't know if you have read the story of how she's got to where she is today, but it was basically not giving up. It was tenacity, it was persistence. You know, once she had worked out that what happened to her mother at Mid-Staffs might have happened to one or two other people, she put an advert in the local newspaper and said, has anyone had, you know, bad experience at the local hospital? 40 people contacted her. Now that's a sort of, you know, reaction to something rather negative, but you could follow that example with something positive, saying, I want to do something about this. Who else would like to do something about this? And you know, using social media, I think it's an awful lot easier today to get people together than it ever was before. Before I did what I do now, I was an optometrist working in the NHS. I had a practice which looked after people who were housebound, disabled, a lot of end-of-life eye care. And I wanted people to know what the needs were of that person that I had seen, because, you know, I would pick up on what their issues were around quality of life and mobility, and simply for me to go in and not communicate, it was okay, they knew more and I knew more, but their GP needed to know and their consultant needed to know and the social services needed to know, so that person's needs could be met. So I used a local committee to bring people together and, you know, talk to local surgeons, talk to local doctors, just picked up those who were interested, who said, oh yeah, that's a good idea, and we got together and worked out something that would be really informative and helpful for all those people who are involved. You know, so it's just sort of, I would say, you know, picking one thing, okay, one thing, what do we want to change? Who else has got, you know, similar feelings? And let's start.
So there's a nice, my message from that, Judy, is sort of start anywhere, go everywhere. That's one of ours, which is just start. So we had a drug and alcohol strategy in Leeds that was, only the councillors from Leeds left here. It was split. Don't ask me why. Historically, very difficult to do it together, Becky. Just really difficult. So we were trying to get drug and alcohol to the top of the agenda in Leeds, not somewhere at the bottom along with homeless people who step over. First thing we did was create a Perturba system. We had 100 service users in the town hall and invited 100 service providers and commissioners. They didn't believe we would get 100 service users, and we did, so that created the first Perturbans. Secondly, Find a Friend, we did everything with service users. We didn't step into any meeting without. So the commissioners come and say, well, we want to talk to you about commissioning. We come as a gang. Well, we're not sure we can meet with service users yet. I said, well, that's the only way you meet. So there's something about how do you just create a move. Who are you anyway, Becky and team, to be doing anything about drug? Don't you work at the university? I said, well, we care about it. There's a whole gang of us at Leeds that care about it. We're going to do something about it. We had no legitimate authority at all. So I think one of the Find a Friends that really matters is patients and service users. Patient and service user stories, surfacing those. If you work at a hospital, bring service users in and ask them to tell their stories to whoever will come. These things change the system. It's some of these small things that just help people have different conversations and different relationships. The other thing that we do that seems to work is doing some go-seeing together. So if you have found a good case, then you invite someone to go with you to see it. And just the travelling in the train, taxi, car there, they find out a bit more about you and you find out a bit more about them, and it's very difficult for them to say no to in the future. So we've got a few tips. You've got some tips now. We've started something. Say who you are, be lovely.
Hi, I'm Jacqueline Jacobs and I work for Marie Curie Cancer Care. And I'd just like to say that sometimes you need to think outside the box as well, and slightly outside your own organisation, because there are lots of charitable organisations out there that raise funds that are really happy to be innovative and to support innovation. Marie Curie has worked for the last, since 2004 on the Delivery and Choice programme, and we've improved palliative and end-of-life care. We've worked with NHS organisations to be able to do that. Liverpool Care Pathway, that was us. Coordination centres for palliative patients, that was us. Rapid response services for palliative patients, that was us as well. And we do raise a significant amount of money that we are happy to work in partnership to invest. Buy a daffodil now. So, you know, come talk to us. We're really good at that. And there are other organisations that do similar things that might be able to give you the leverage, the expertise, the knowledge to be able to put your case forward.
Yeah, there's another version of Find a Friend to perturb the system, isn't it? You didn't think your one problem was going to become the centre of the conference's attention, did you? Has anybody else got anything else they want to add to that or offer, or any other great nuggets of sadness they want to share? Or have you got the answers now? What you might do when you go home? So one of the things I suggest is that you don't go home and not talk about what's happened today. So the first thing to do is find your first friend. Something you picked up on. Stephen, you picked up something about maps and apps. I've already introduced you to a friend. So we'll do a bit of that maybe. We'll commit to that. So have a think about what you might commit to from having spent your day out of the NHS and had a good think. What would you like to commit to you think might make a difference? And for anybody who want to hang around for 10 minutes, you're welcome to approach our speakers and ask them for anything that you think might be useful to you. But it's been a pleasure to see you today, and safe journeys home.